Welcome to the Warren Files, presenting true insights and experiences from the paranormal world, with your host, Chris McKinnell, Director of the Warren Legacy Foundation for Paranormal Research.
Hello, and welcome to another episode of the Warren Files. I'm your host, Chris McKinnell, the Director of the Warren Legacy Foundation for Paranormal Research. Today, we are very, very lucky. We are talking with the Chief Medical Consultant for the Foundation and someone I have known since I was 19 years old. Dr. Andrea Chernin, thank you for coming on. How are you doing today?
Oh, it's my pleasure. I'm doing great, Chris. How are you?
I'm doing great, thank you. So, I always go back to when we first met because that was a special weekend. We were up in Halifax, Nova Scotia. It was me and my grandparents and Lorraine, and we had quite a few adventures that weekend.
We sure did. It was a wonderful weekend where my favorite professor of all time, Dr. Devendra Varma in the English department, taught Gothic literature. And we were quite certain that he was about 400 years old. And
he was extraordinary.
He was extraordinary. And I had asked him for a referral to med school. And he asked me a favor, that if I would organize the gathering. And this was a meeting that included your grandparents, Ed and Lorraine Warren, and Dr. Radu Florescu and Raymond T. McNally, who were Gothic professors as well. And I think Radu Florescu wasn't he a descendant of Vlad the Impaler?
Yes, he was a direct descendant of Dracula. And those two were partners who discovered Dracula's castle.
Oh, so cool. Yes. And so we had this wonderful weekend, and I was the organizer. So I had the pleasure of taking you and your grandparents around to all the different media presentations. So I got to see the inside of the TV stations and all sorts of things and just hang out with you guys. And it was really such a wonderful time. And then to MC the presentations over the weekend.
Yeah, I still remember you had taken me out to downtown Halifax to a nice little pub. And when I came back to the I'm upset about that. But
it's okay. Keep going.
when I got back to the hotel room that I was sharing with my grandparents, the door was locked. And my grandfather came to the door. He opened it, and it was pitch black inside. And he said, "Shh, there's a ghost in the room." I was like, okay. So I walked in, I sat down on the bed, and my grandmother was having a conversation with a spirit. It was a gentleman whose name is Harry Price. Now, for people who don't know who Harry is, Harry Price was very famous in the 30s and 40s for his investigation of Borley Rectory in England. One of the most haunted places in all of England. It burned down in, I think, around 1950. I can't recall the exact date. But the church is still there, and it is still very haunted as well. Me and my grandparents did do a number of investigations there. But Harry was there in the room. Now, I didn't see him with my own eyes, but he was talking to my grandmother, and he wanted to be a part of the gathering. The fact that we, as a group of paranormal investigators, were gathered together was enough to draw his interest and draw him all the way to Canada from his resting place in England.
Amazing.
Yeah, that was wonderful. He actually said that he would be following me for the rest of my life and watching over me. Because he felt that I would be doing something great in the work. And for years, I thought he was completely wrong because I was keeping such a low profile. But who knows? my son was raised knowing that we had a family ghost, Harry Price.
That's marvelous. And
Yeah.
he's very right. You're onto some very special things in the near future.
Yeah, actually, it's pretty exciting. I'll be
Very exciting.
leaving for Spain in a little while, very little while, a few days, and spend about 5 or 6 months there learning the language, doing some podcasts like these, but on location. Then I'll be doing a series of lectures and longer seminars for people who actually want to be in this work.
Yes.
In Britain and meaning England, Scotland, hopefully Northern Ireland, Ireland as well, and maybe even the Netherlands. I've got people working with us to set things up in New Zealand, and I've got a couple of production companies in Costa Rica and Argentina looking to get sponsorship to bring me over there. So hopefully I'll get to do an awful lot of research and share it with everybody very soon.
Well, you're looking to build a marvelous legacy of really high quality education globally, and that's to your credit.
It's so important to me because
Yes,
it is so different everywhere in the world. It's not all just Christian demonology or infestation, oppression, possession. It manifests, the paranormal manifests differently in depending on the belief system of the people in that culture.
right.
And I am looking so forward to delving into that more and sharing it with everyone.
And that's the marvelous part, really, is that the education for the rest of us is going to be absolutely marvelous.
Well, that is one of our major goals, with the foundation. Besides doing research, teaching the public, and helping people.
Yes.
We also obviously want to raise the standards of professionalism in this field and
Absolutely.
teach the next generation.
And I'm glad you included me in this. That's what makes it so fascinating. I mean, my work as a former physician, now retired, was, it's more than just working in an office and seeing patients one-on-one. The medical consulting for your foundation has been a very exciting part of my career.
Well, you have a very unusual resume, and you've been exposed to so much in your life. We are really blessed to have you. Let's talk a little bit about your past with my grandparents and your personal paranormal past.
Sure. As I mentioned earlier, we had the weekend together, and then there have been times when I've actually been traveling and came down to visit, you and your grandparents, and at their museum as well. But I think it was prior to that when my daughter was young, a young child. We had a situation where she would scream in the middle of the night or any time of day and say, "Mummy, pick me up. The monkey is here." And was with absolute urgency and distress in her voice. And I'm like, well, that's a clever way to get my attention. And I never really thought too much of it until one night I was, home visiting my mother, and we were all sort of sleeping in the king size family bed at the time. And she wakes up around 3 a.m. and she's screaming again that the monkey is here. And I have my face buried in a pillow, and I'm like, well, what does it want? And she looks and pauses and kind of looks up, and then she says, "It wants to take me away." And I'm like, well, where does it want to take you? She pauses and waits, and she goes, "To a very, very bad place, Mummy. Make it go away." So again, my face is buried in my pillow, and I'm like, "Go away, monkey," in a sleepy voice. And she says, "Mummy, it's not going. It's not going." And then I remembered what Ed said. And so I said, "In the name of God, monkey, go away. And she then sighs a sigh of relief and goes, oh, it's gone. And this little tiny body, she's just a little toddler at the time, rolls over, bum up in the air, and starts and returns to sleep. That was it. Well,
she was like 2 or 3 years old at the time.
She was even less, I think, at that point. And she was quite articulate, even under the age of 2. And well, at that point, she's sleeping, and now my mother and I are wide awake. Turn the lights on. We were like, what just happened? And so that now got my attention in a different way. And unfortunately, this monkey thing kept coming back to my little girl's attention. And it was nothing we could see, but it was always to her left, and it could be day or night, and nothing moved. Like, we didn't have any poltergeist activity, but we certainly had a spooked babysitter from Japan who was really spooked when she would also see this monkey in her babysitter's home. So it got to a point where the babysitter was going to quit and so on. And I actually picked up the phone and called Ed and explained to him what was going on and said, what am I doing wrong? Because it keeps coming back. And so at that point, he said, you have to say, in the name of God, monkey, leave this place and return from whence ye came. So don't just step outside the door, but go away. Go home. And it was very interesting. I went around each room of I was a med student at the time, and I just went around to each room in our small apartment and said this. And then my daughter came home from the babysitter that afternoon, and I never would mention this thing spontaneously because I dread it when she would react. So on this occasion, I say to her, so have you seen the monkey? And she's playing with her blocks on the floor, and I'm laying on the floor in front of her, and she goes, oh no, Mummy, the monkey's gone away. And I'm like, where? And then she stands up and toddles over to the window and points out the window at the sky and said, way, way far away. And then she turns around with her head down, starts playing with it, plops down again, plays with her blocks, and says, and he's never coming back.
And you, of course, never told her what you had done.
Well, no, of course not. And I'm like, good. And in fact, actually, it never did. It never happened again.
All right. You performed a house cleansing.
I did.
Yeah. Well done.
Thanks to your dad. Thanks to your grandfather, Yeah. I mean, I often thought, my goodness, if she had kept this up, she would have been labeled something.
Yeah.
And misdiagnosed and treated for something she didn't have. And my goodness, it could have changed her life in such a very negative way to have not had that, education from Ed.
And I think that, I mean, my personal belief system is that these things happen for a reason. Yes. And that experience was pivotal in your own life.
Yes.
It made you more open to what we do.
Yes, indeed. Yeah, it very much so. And, and working in the field that I work in, when I was a clinical clerk on the mental health wards, we had a lady who was exhibiting very bizarre behavior and actions that were not physically human, I guess you could call it, just to keep it vague enough, at least. And
well, I'm curious.
Yes, and the team that was looking after her included a doctor from Jamaica who very aptly pointed out that She doesn't need a doctor. She needs an exorcist.
Hmm.
And so, there were these pivotal moments where things were brought to my attention that maybe most clinical clerks would not have experienced during their medical school training.
Did they
And
bring an exorcist in?
I was not on the service for her full stay, so I don't know what they did eventually do.
Oh, I hope so.
Yeah, I would hope so for her sake as well. But this is the sort of thing that, it opens. I have an insatiable curiosity, an open mind, and critical analysis is important as well.
Well, absolutely.
And it just, said that there's something else on the differential that we need to consider when people are experiencing phenomenon.
And that's a very important point there, because it goes both ways. Sometimes what we think is paranormal is actually medical or psychological.
Exactly.
And sometimes what we think is medical or psychological is actually paranormal, or a combination thereof.
Right.
And that's why having you is so important. When we work, and we work a few cases together, having a medical protocol is so important. And this is something I'd like to share with anybody out there who is an investigator, is that you're not expected to know medicine, but it would help if you had some awareness of these possibilities, so that you might recommend that they get medical testing. What, for instance, we had worked a case out in the western part of the United States.
Yes, that's good. Let's talk about that first. I think that was a really, really good one.
Yeah. Why don't you tell the audience about that?
Sure. Well, you brought to my attention this case where you were very concerned because the history you received was that this woman was fighting for her life underwater and in a bathtub, and the boyfriend could not physically bring her up above the water, or if he did, she kept going back under again, being pulled under. And then there were other instances. Clearly, if he hadn't been there to rescue her, she would have drowned.
Mm-hmm.
And so that's where, I mean, you were aptly very concerned. And there were other instances in that same case where, not in the water, but that she would,
in her bed, yeah.
In her bed would start, making guttural noises, and her pupils would change shape. And this is, really piqued my interest, to the point where I asked you to, because as you know, just for the audience to understand too, as a medical consultant, I don't work directly with your clients. I work with you. Okay.
Right.
So that I'm consulting to you, and you are dealing with your clients. So,
exactly.
Right. So in this case, I asked you to ask them to get to draw a picture of what the pupils look like when they change shape. And what came back was a sort of teardrop type shape.
Mm-hmm.
And so I, as medical consultant, then go hit the Google Scholar and look up the research on pupils changing shape in medicine and what it might reflect. And sure enough, I came across an article of pupils changing shape, and it was the exact same shape that they had drawn. And it reflects an atypical type of seizure activity, where a part of the pupil will, or the iris will contract, so that it does end up looking like a teardrop. And so at that point, I copied the article and sent it to you with recommendations that that they take this information to their doctor or to the emergency room to get to be seen by neurology for
Mm-hmm.
seizure activity, and that it certainly that also then explained her the strength of her muscle contractions to resist trying to be lifted out of the tub, that she
Right.
was having a seizure in the bathtub.
Right.
And then there was you collected more history, I believe, on the case to find out why their interpretation of her behavior was more of a paranormal phenomenon in their mind rather than a medical.
Right. Yeah, unfortunately, and this honestly, the description that you just gave as to what the phenomena was, what they were experiencing, the symptoms.
Yes.
Anybody who was a paranormal researcher, their first instinct is, she sounds possessed.
And this is what the boyfriend, I understood the boyfriend was saying, was that
Yeah.
The devil or the demon was pulling her back underwater. That was his interpretation of what was happening in that moment, and how frightening, really.
Yeah, I mean the whole voices coming out of her, or the sounds, I should say.
Yes.
The fact that they had a child in the home that they were fearful would be hurt somehow. The child was never in any danger, but he was certainly scared for the toddler.
Of course, the situation was frightening, regardless of what the actual origin was. Yes.
Yeah, and there was a history of some drug abuse in the home. There are underlying reasons why people are affected by the paranormal. In this case, it wasn't paranormal. It was completely medical. And it is important for anybody who does this work to rule out everything natural that you possibly can before jumping to the paranormal.
Yes. And that's much the same in my work, as a hospitalist on a psychiatric unit. Is my role is to look for medical conditions that may be contributing or compromising mental health. Okay. So with your staff, they're looking for, and researchers, they're looking for, as you say, any underlying natural phenomenon that could explain, or medical phenomenon that could explain what they're experiencing. And this is where it's really important to train the researchers to help your clients frame their experiences according to their observations, not according to their interpretation.
Right. And I was actually going to bring that up next.
Yeah,
and thank
please
you.
do.
Please, would you please explain, because our clients understandably are very worried about going to a therapist or a doctor and saying something like, "Doctor, I'm hearing demonic voices tell me to kill my boyfriend." Instead of putting it that way, or a demon is constantly grabbing my foot, how would you suggest that our clients talk about these things with their doctor?
Well, again, they should, and I'll start with the example of the bathtub, the lady in the bathtub. Instead of saying, my girlfriend was possessed and the demon was trying to kill her and was pulling her underwater, say that my girlfriend was, if what they observed was that she was shaking violently, she couldn't control her own muscles, and there were violent muscle contractions that were resisting my efforts to try and pull her out of the water.
Yeah, she was bowed and had a very stiff back.
Yes.
And she could not be lifted.
Yes. And so that's the sort of thing that would help a physician to understand what's going on medically. Now, right. Someone saying a demon is pulling on my foot maybe is really what they're trying to communicate to you is, I mean, apart from the issue of how they're interpreting their world, that's another issue.
Right.
But in terms of what they're trying to tell you is that they're feeling a tugging sensation, or they may feel like something's gripping, like a squeezing sensation around their ankle or foot, for instance. And that's what, the researchers can try and help people learn to describe their symptoms, what they're experiencing, in a way that improves the outcome of their visit. Okay.
That's a very good way to put it. I was contacted by a young man yesterday.
Yes.
And this is somebody that I've talked to in the past. He is a completely uncontrolled, untrained empath. His abilities are out of control. When he has a bad headache, when he's anxious, because he also suffers from anxiety and PTSD, when he has these problems that occur, the lights will blow out. His cell phone, as soon as he touches it, will die. The battery will burn out. And these are typical things that happen with empaths. It's not necessarily paranormal. It's just normal for uncontrolled empaths. But he's also now having night terrors. He is starting to sleepwalk. He's dreaming constantly about Annabelle, the Raggedy Ann doll, not the movie.
Oh, yes, yes.
He's also hearing a voice in his dreams that's saying that we are many, which I constantly have people telling me that the demon that's coming after them is called Legion. It seems to be the one that has entered the public consciousness the most.
Yes.
So we hear that a lot amongst Christians in North America. We hear that an awful lot. As well as Azazel and a few others that Zozo seems to be a popular one right now. But these things actually don't have names. They're just used as ways of terrorizing the people that they're trying to get energy from. In this case, we're still under investigation. We've only been looking at this particular incident for 24 hours, and I'm still waiting to get more information from him. Mm-hmm. But we definitely have to look at the underlying issues that make him vulnerable.
Yes.
And that means the fact that he is an uncontrolled empath, that he does suffer PTSD, that he does suffer from anxiety, and he's not in treatment. Because sometimes the paranormal comes through because of those vulnerabilities, especially in negative hauntings. Now, whether or not that's because that person has a mental illness and therefore what they interpret, the way they interpret the phenomena is negatively, and therefore it gets worse.
Yes, well, you can certainly have a mental illness and paranormal phenomenon, or one or the other.
Oh, absolutely.
Sure.
Absolutely. These things, it's a true negative entity is a predator and a parasite. And a predator is always going to look for the weakest victim. They're going to look for the one that they can get at the easiest and then feed off of. And the more fear you give, the more negativity you give, the stronger you make it, so that it can then cause you even more harm. It's a cycle.
Right.
And it's a vicious cycle. And it's something that people have to keep in mind at all times. But let's as usual, you and I, we get off on our tangents. We have a good time doing this.
Forever.
But, One of the things that I wanted to talk about, because you have done so many different things in your life in the medical world, and you're not afraid to, as you said, you've got an insatiable curiosity.
Yes.
So you've looked into all sorts of different methods of helping people.
Yes, I have. And we in Canada, we refer to that as complementary and integrative medicine. So I practice very much conventional or I did, in my former practice, very much conventional medicine plus integrating the complementary or natural therapies in as well.
And are those, I guess we call those holistic
Yes,
medicines,
yes.
homeopathic remedies?
Yes, mostly I focus mostly on nutritional, but yes, I also am uh, familiar enough with some homeopathic remedies to have recommended them in my former practice. Yes.
So, for the people who don't know, what is homeopathic medicine?
Homeopathic medicine is a form of medicine that came out of a form of therapy that came out of Germany approximately 200 years ago. And it was the recognition that natural substances in their concentrated form, may cause symptoms, let's say. For instance, an onion or the juice of an onion, when you're cutting it, will make your eyes burn. But what they discovered is if you progressively, and there's a very strict protocol on how to make a homeopathic remedy. But if there's a progressive dilution, let's say you took 1 drop of onion juice and put it in a container of water and succussed it in a way that it imprinted the information of the juice onto that onion juice onto that water, and then took 1 drop of that and repeated the same method, and then took 1 drop of that, and so on and so on. Eventually you get a substance that carries the I'll call it the vibrational signature or the frequency signature of that original onion juice, but not the chemical properties. So the way people say that's impossible, you can't imprint something onto something else. And so I say to them, really? So when you put a CD into your player and you are hearing music, where's the band? Okay, so we are actually in the modern world imprinting vibrations onto other mediums like originally vinyl and now CDs. Okay, and and producing the music that was there originally generated by a band, or the vibrations that were originally generated by the concentrated substance like onion juice, for instance.
It sounds an
And
awful lot like quantum physics.
it's very much physical medicine. It's physics medicine. And the so in its homeopathic dilution, onion juice homeopathically diluted will actually, when you take a drop of it, it will eliminate or cancel out the burning sensation in your eyes. So if your eyes are burning because you were working with onion juice and you took a homeopathic remedy or dilution of onion juice, it would cancel the sensation. If your eyes were red and burning from something else, then still that same, because it's based on symptoms, how our bodies express symptoms. If you take this preparation, it will cancel that symptom.
Really, even though it's not caused by onion.
Exactly, because it's about the symptom.
That's extraordinary.
So they found that things that cause that symptom can be made into a homeopathic remedy that eliminates that symptom. Isn't that something? I was always
That's amazing.
by that. It's just like a sine wave, if you just alter the the cadence, then if you have an opposite wave, then they cancel each other out.
That reminds me of stories I remember hearing, and I can't say even, who, but stories of royalty that would take like small amounts of poison to build up their resistance to it. I mean, it's not exactly the same. It's not because you're actually taking the poison.
Yeah, that's more of a desensitization protocol, and it's similar to what we do with allergy. If you're allergic to trees, then we use very small, minute amounts of that to inject to desensitize.
Yeah, I did that for years.
Yeah. Oh, fun, hey?
Well, I'm not afraid of shots anymore, that's for sure.
Well, that's good.
But so let's talk a little bit about nutrition, because one of the things I found fascinating in our conversations is how a vitamin B deficiency, for instance, can lead to hallucinations.
Yes, and that's a very important topic. And this was something that was discovered in the 1950s by a Dr. Abram Hoffer, who actually mentored me one-on-one when he was in his 90s. And he was a serial biochemist who discovered that the condition of pellagra which is a vitamin B3 or niacin deficiency, was more rampant at that time because of the refinement of flour. So all the important B vitamins were in the husks, or what we would call the whole wheat, okay, the husk of the wheat that was being refined out of the new wonderful white flour that we were now eating. And so he's responsible for the enrichment that has since gone back into cereals and flours and grains.
Wow.
And that intervention alone basically eliminated the insane asylums. He eventually went on and became a medical doctor and then a psychiatrist, and discovered in the course of his education that the people with schizophrenia were exhibiting the same symptoms as the people with pellagra. And so he wondered if it was actually, in fact, the same condition. So he started giving very large doses of niacin to schizophrenic patients as part of his research, and found that 50% of them improved dramatically, enough to leave to be discharged from hospital.
Extraordinary.
And so he became the founding father of nutritional medicine, and also called orthomolecular medicine, or orthomolecular psychiatry. And so it was a blessing, really a privilege, to be able to sit across the desk from this man and this doctor and be trained by him in the nutritional approaches to mental health. So of all the, for instance, again, so my interest is in medical conditions that can compromise mental health. If you are niacin deficient, you're not going to be able to break down adrenaline properly, and it then breaks down into a toxic metabolite that is both neurotoxic, toxic to the brain, and toxic to the heart. So that people under stress. So so then it becomes a matter of which came first, the paranormal phenomenon or the mental health, because it's understandable that if you are experiencing either one, let's see, if you have acute stress or chronic stress in your life, it's going to start depleting minerals and vitamins. And in particular, just we're highlighting at this point niacin, vitamin B3. And so the condition can progress from the simple pellagra symptoms of upset tummy or diarrhea, dementia, forgetfulness to dementia, and dermatitis, maybe rashes, from rashes anything up to psoriasis, and the dementia can progress from anything from altered memory to psychosis.
That's fascinating.
So
And
you may
so, is
not
that something that people can get a blood test to figure out?
The niacin levels in the serum often remain normal in spite of intracellular deficiencies. So it is a very hard test to do. There are actually urine tests that can determine if a person is lacking niacin.
Okay.
There's, of course, other B vitamins that get depleted with stress as well, like B12. And vitamin B12 is responsible for the size. It contributes to the size of your red blood cells. And when you're B12 deficient, your red blood cells are larger and they don't circulate as well. So people can have altered mental health and altered physical health from a B12 deficiency. And often one of the things we see is anxiety.
I was going to ask you about that because so many psychics and, of course, people who are being troubled by the paranormal are also suffering from anxiety.
Well, yes.
How can we help them with that part?
Well, this is where we look at, let's get the blood tests done to look for things like B12, look for magnesium, for instance. Serum magnesium is not a very sensitive test. It most often, even in deficiency states, will be normal. What needs to be tested is red blood cell magnesium or ionized magnesium. There are two different types of tests. So of the three types of magnesium testing that can be done on the blood, the one we use most commonly is the least sensitive test.
Oh, that's awful.
Yeah, well, yes. And but if that one's abnormal, then you really got a problem. But really, there are many times when the magnesium is low. Magnesium is one of the first minerals to be dumped by the body under stress, because under stress, our systems are designed to fight or flight. And so magnesium is a calming mineral that keeps your blood pressure low and your blood vessels are dilated and is low and your blood. So imagine that's not what you want when you're in a stressful situation and you need to run. Okay.
Right.
All right.
So if you're being terrorized,
we want your muscle tone high, your blood pressure up, and your heart pumping to get you the hell out of that mouth of the bear. Okay. So to run or to fight. And so magnesium is appropriately dumped by the kidneys to allow for a proper protective stress reaction. The problem arises is when the stress is chronic. And so when magnesium is deficient, niacin will pick up the slack. And then when niacin gets deficient, then you get those symptoms that we discussed earlier. So stress can progress from the original trigger to these horrific symptoms that plague people that can include altered perception and psychosis simply by the progressive deficiencies of, or your body's using up the minerals and vitamins that are supposed to be running other functions and they're running out of these vitamins because they're using them to manage stress.
So to bring this back to the paranormal.
Yes.
Here we've got any ordinary haunting. The people are normally terrified, either because they don't understand or because there's something truly evil in the home.
Yes.
So their magnesium, their niacin are dropping. Is this something that, as a general rule, doctor, Should we be saying to all of our clients who are in these bad situations, please make sure you're taking a good multivitamin? Will that help the situation?
This goes well beyond the levels supplied in a multivitamin, and what we as what your group as paranormal researchers and supporters can do for these clients is to recommend that they see a healthcare provider, doctor, naturopath, or whomever can order the necessary blood tests to see that they are nutritionally supported through all this stress so that they can be stress resilient or restored to stress resiliency, because
And
it basically the nutritional deficiencies make a bad case worse.
right. So this would also for um, for our psychic support group that or two psychic support groups. We have one in English and one in Spanish.
Yes.
For these groups, many of these people suffer from anxiety on a chronic level
Yes.
because they're constantly picking up the energies of others around them.
Yes.
Would you recommend then that they also get these blood and urine tests and see if they need nutritional therapy, if that's the right term?
Nutritional therapy, yes. I would suggest that they do everything they can to support their own optimal health and stress resilience. So they do need to take care of themselves. They do need to establish healthy boundaries, do their own cleansings. Some do salt baths, Epsom salts or sea
Yep.
salt baths, and
Always salt, less salt.
and yeah, but even like for instance, the sea salts or Epsom salts are high in magnesium. So if your body needs them, they're going to absorb them through the skin.
That is fascinating.
Okay.
Thank you.
So so these are, anybody in a high stress job, whether you're an emergency room physician or or you're a paranormal investigator, uh, you're in high stress jobs and you need to do everything possible for self-care, to keep yourself functioning at a high level for your own benefit, the benefit of your family, and the benefit of the people you serve. That's it, as a general rule.
And that's good advice for anybody, really.
Indeed.
So, dealing with these cases that we come across all the time,
Yes.
do you have some general advice for teams out there, kind of a medical protocol that you would recommend?
Again, it depends on the symptoms.
Right.
So you'd have to break that down into a not as broad a question, actually, Chris.
All right, that's fair. But I guess the thing to keep in mind is that our teams should be open-minded about it possibly being medical, and that even if a psychic who is on your team tells you absolutely there's something in this home, that's true. There might absolutely be something in that home, but it doesn't mean that there isn't also a medical issue here that should be dealt with, because the underlying issues are so important. Just because you do a house cleansing and that spirit is gotten rid of, that doesn't mean that the vulnerabilities that made that client open to that attack are taken care of. That person could still be attacked again by another entity, if not the same one coming back.
Exactly. And the thing is, with all the stress that the family or the individual has been through with the paranormal phenomenon, they are left in a nutritionally depleted state from the chronic stress.
Absolutely.
So that does need to be addressed. Again, we're not just trying to eliminate a problem. because zero is not necessarily a great place to be. Either you're experiencing optimal health and there's no paranormal activity, or no unwanted paranormal activity, and or you have paranormal. So just to remove and it's the same thing in medicine. It's not just enough to remove the disease. You have to go farther and actually optimize their health. So yes, the paranormal investigator's job is done when they have, removed the paranormal activity or resolved the paranormal activity. But as part of the recommendations, it behooves them to say, please follow up with your healthcare provider.
Absolutely.
To
we
restore,
to
restore what you've lost during all this stress. It takes a toll.
One of the things when we were talking about homeopathic medicine, I know it's not the same, but it reminds me of witchcraft.
It's interesting you say that. I don't know enough about how you view witchcraft. So could you explain, because I can't answer that. Can
Sure.
you explain what you mean when you say witchcraft? Because to other people,
Absolutely.
it could be a derogatory term. And
Yeah,
I
no.
really don't think you mean that at all.
No, not at all. Not at all. No, I there are many different forms of witchcraft. If you're anywhere from Nigeria to South Africa, witchcraft is synonymous with black magic, and it is considered evil and terrifying. But that's not all it is. European witchcraft, on the other hand, which in my studies seems to be the very first religion, going back 35,000 years, is more about being aware of nature, aware of the energy in nature, the power of nature, and working with the world, whether that be spirits or not. But when we're talking about homeopathic medicine, it seems like imprinting something on another fluid. Seems to me but like a dilution, similar to what they would do in some types of witchcraft, where they'll take the energy from nature and use that to help people.
It seems a little, I don't know if it would be interesting to learn also from the indigenous cultures, whose, of course, their chronicles of the earth and nature and how to use nature to heal and how to protect it at the same time seems very much like what you're describing in European witchcraft.
Yes.
Our own indigenous cultures are very adept at protecting Mother Earth. I don't know.
I should also say I misspoke a little bit, because shamanism is also a form of witchcraft, which is accepted throughout the world, and it is not considered evil at all. It's just the idea of the witch in Africa has been vilified, unfortunately.
It's been vilified in Hollywood. It's, it's
ridiculously so.
Yes. So this is where it makes it difficult to address your question of trying to compare homeopathy with that, because again, people are going to misinterpret or misunderstand the context. But that said, we are in homeopathy. They are taking natural substances, but creating something different from them in that it's like an opposite, okay, in terms of the symptoms. One will cause, for the substances that cause symptoms, the homeopathic remedy will eliminate those same symptoms.
So you could do
the indigenous cultures or if European witchcraft has anything similar. I don't know.
Honestly, I I'm not as well versed in it yet as I would like to be, but I certainly have enough witches in the foundation that I'll be talking to, and I will get answers for everyone.
Yes, because you've certainly made me very curious now.
Well, you stay tuned as well.
I will. When questions generate more questions, I get very intrigued.
Me too. And I'm going to be going around the world and doing a lot of studying. I've done this 39 years, and I've barely scratched the surface. I can't wait to see what the next, all right, admittedly, maybe 20, 25 years tops, have to show me.
Well, I'm excited to see what it shows you, and to share in the work that you're doing. It's really wonderful, Chris, and I wish you all the best in your travels.
Well, thank you very much. And Dr. Andrea Chernin, I just want to say thank you so much for coming on today. Thank you for helping to educate people and open their eyes to other possibilities. Everything.
They appreciate the opportunity.
I was going to say, not everything that goes knock in the night is a ghost, and that's okay too.
Exactly.
I'm sure you and I are going to be talking again, and we'll have some more fascinating conversations for our audience. And folks, I hope you will tune in next week for the next episode of The Warren Files.